This podcast is brought to you by Caoimhe Hartley. Whether you're feeling the effects of menopause or your menstrual cycle, discover what's key for you in less than 5 minutes. With tailored supplement recommendations, information and insights on caoimhehartley.com.
Hi, I'm Renée.
And I'm Donna. Welcome to the Key for Her podcast.
In this series, we aim to educate and open up honest conversations with both medical professionals and real-life women.
We want to shine a light on those topics that sometimes go unspoken about and help empower women to know what is key for their health and well-being.
Thank you for joining us on this episode today of the Key for Her podcast. So today we talk to women's health expert Caoimhe Hartley. Again, this is episode 2 with Caoimhe. She's the founder of Menopause Health in Dublin, a specialised menopause health clinic. Her goal is to help women access the best advice and individualised care for all stages of their lives and perimenopause and menopause. So today we are focusing all on perimenopause and menopause, and thank you for joining us.
Hello. Good to be
Hello,
back.
Caoimhe. Thank you.
Tell us a bit about what you do at your clinic and why you started it and why you saw the need for a specialised clinic in Dublin.
Yeah, I think looking at need first is the main thing. When I worked I worked abroad, so I worked in a lovely big women's clinic in Canada, and I did a lot of hormonal health and specialised women's health there. And I remember noticing that a lot of women were kind of shoehorning in these symptoms just as they were leaving. So they would come in about something else. I have heavy periods, or I have, I need a prescription for X, Y, or Z. And as they were maybe leaving the room, they'd mention,
by the way,
listen, just like, it's probably not that important. There's probably nothing you can do about it. But I just thought I'd mention, or it would come up maybe during the consultation because they have heavy periods or they were having other symptoms. And I would mention that maybe this could be hormonal change related to menopause. And
they probably go,
They get your handbag and whack you across the head.
Yeah,
Say,
how
"I am
dare
not
you."
how very
menopausal."
dare you. Yeah.
yeah.
And so it was, number one, a really difficult conversation for that reason, if they weren't prepared, if it hadn't occurred to them. And number two, it was often something they were implying, look, this isn't really important. I know there's nothing you can do, but... And their hand is sort of on the door handle, and you kind of feel like saying to them, sit back down.
Sit back down.
Like, this is a big discussion, and actually this is maybe where you start future planning for the rest of your life, for your
this
health.
Is more important than what you came in with.
Yeah, that thing on your toe can wait, because this is actually really, And so I felt it. So we started offering appointments for menopause specifically, and realized that like really quickly we were just kind of overrun, and it just became really obvious there was a demand then. And so that just translated when I came home to Ireland. Same idea. I think women here were equally challenged to find the time, and my background is general practice, and GPs are given 10 or 15 minute appointments, which it's just really hard. How do you cover something so broad and so individual, in such a short space of time?
Because how many symptoms are there?
Well,
Is it
you can't even put a number on it in a way.
Yeah.
And one of the problems, I think we kind of spoke a little bit about things like puberty and that kind of thing previously, and how, and I'm a stuck record, like everything is a spectrum, but it is. And that's the problem with menopause as well, that it is so variable and so individual.
It affects people in so many different ways. They're probably thinking, I don't have hot flushes or night sweats and my periods haven't stopped. I'm good. I'm not in perimenopause. But discuss maybe like the age of where it can actually start and how far out perimenopause can start before actual menopause. Because there's women that are in their late 30s or early 40s that are getting these symptoms, and they actually just think they've turned into a hypochondriac when actually and they're feeling bad and they don't know why, and they have these random list of symptoms, and it just hasn't triggered with them that it actually could be perimenopause.
Yeah, and you can't even put an age limit on it in either direction. But if you're looking at averages, so usually anything from the age of about 40, but typically it's more from 45, just average.
Yeah.
But you're right, women as young as in their late 30s or early 40s can start having symptoms because of hormonal changes. And again, if you're looking at statistics, 1% of women, their periods will stop. They'll be fully menopausal, their ovarian function will stop under the age of 40, and it's about 5% under the age of 45. So they're small numbers.
Yeah.
But they're women who they've ground to a halt with their ovarian function.
Okay.
There's all these other women then who are at that age, their ovarian production of these hormones is not what it used to be. It's much more variable. It fluctuates more, and they're getting symptoms as a consequence of that.
Okay. Yeah, because let's talk about the symptoms as well, because it's not just, night sweats or hot flashes. Like my symptoms started at around 37, 38, and I'd noticed like dry eyes, my bladder wasn't like it used to be, brain fog, just these random kind of things coming in. My cycle being off by maybe a couple of days, but it was never really regular, like to start with. It was always like, out by a few days. So I never felt like I was in perimenopause. It just felt like, oh, sure, these are just a couple of things that are just happening to me now. So I think it's important for women to realize that just be open-minded about it, because the sooner you realize what it is, the sooner you could possibly do something about it.
Yeah, totally agree. Yeah. And I think, it's not a fixed point of time. It's not like you go, I have a normal menstrual cycle, normal. Oh, look, I'm perimenopausal and that's it. Everything's changed. And then you're that for a few years, and then look, my periods have stopped and that's it. What we're actually it's not really your periods that are the important bit of this. In a way, it's what your ovaries are doing in the background.
Yeah.
And we're using your periods just as a way of kind of reflecting what's going on in the background. But you can have normal, regular periods, as in they're not varying by more than 7 days, month to month. But in the background, start seeing some hormonal change. And women who are sensitive to that, and that's genetics.
Yeah.
It's not personality. It's not, it's all genetics. Like they've shown even PMS is probably genetic, and women who get worse PMS, it's because of genetics. So if you're more sensitive to that hormonal change, you will start to see these subtle changes in how you feel month to month much earlier than, than other
just
women.
Creep in over time and you hardly realize, and then all of a sudden you just wake up one day and went, oh, light bulb moment.
Something's changed.
Something's changed, because we have a list here of a lot of symptoms that women are experiencing, like insomnia, disrupted sleep, more intense PMS, thinning hair, brain fog, weight gain, especially around their middle. A lot of them talk about that. Skin and hair changes, like with dryness and itchiness, dry eyes, dry mouth, painful bladder, tingling fingers, low mood.
This is going to take up the whole episode if we keep going.
But a lot of people...
Sounds delightful, doesn't it?
And I suppose they're, it might be reduced libido or more UTIs or like...
But hang on a minute now. We're going to terrify everybody. So let's rewind. Okay, for a minute. Let's pull it back. And let's start with the basics.
Yeah.
Because I think it's good to understand,
why those things are happening. Yeah.
Like, what's going on?
What's causing these random changes?
Yeah. Why is this happening to me? Yeah. So essentially, your ovaries have a timeline, and as they age, at some point, and that point is different for everyone, they don't have the same number of follicles at the beginning of every cycle, and so you start producing less estrogen. Early on in this process, your brain is aware of that. It's like, oh, something has changed. You're not producing follicles like you used to, and it releases hormones to sort of stimulate your ovaries more. And the problem is that in younger women and early in perimenopause, you're kind of good at responding to that increased stimulation.
Okay.
And so now you overproduce at times. And so the range of your estrogen level is no longer, between X and Y. It's
swinging
higher at some times and lower at others. And the variation between those two amounts is much more dramatic than it was several years ago. And so it's like going from, some bumps on the road to being on a roller coaster, and much bigger dips and much bigger highs. And when you're overproducing estrogen, we see breast tenderness, we see bloating, we see headaches, big drops in these hormones. They're what cause PMS to begin with. If that drop gets more and more and more and more dramatic and more steep, those PMS symptoms get worse.
Yeah.
And that's what perimenopause is, essentially.
Because a lot of women, they tell us that their PMS seems to be really intensified to the point where they're feeling a bit like rage and stuff sometimes. You know? And
I hear that a lot.
It can affect people's relationships as well. If they can't understand really what's going on. And I think it's really important for them to talk to their partner or trusted friend or family member.
And that they don't have control over it necessarily. You know, we usually break it down into, so, you know, there's mood and emotional symptoms, and it's quite common to get anxiety and depression, rage, irritability, those kind of symptoms through perimenopause. They're probably more common in perimenopause than they are in menopause. Because when you get to menopause, you just don't produce any estrogen, but you're stable.
Okay.
It's the same month to month, and your brain prefers that, whereas the fluctuating hormonal environment, it doesn't like half as much.
Making you far more say like irritable,
emotional,
low mood. Does it affect your energy?
Yeah, it can do. Yeah, absolutely. Just think of PMS in general and how that tends to affect everybody differently. And some people get more physical symptoms. They get the breast tenderness and bloating, and they get cramping, or they get tired. And other women, you know, they find, well, actually physically I'm okay, but my mood is awful, or whatever it might be.
How do you group these symptoms then, like you said there about these kind of emotional symptoms or mood? What are the other, how do you group them all into different?
So mood and emotional, your kind of mental health almost symptoms. Then you have physical symptoms, so that's sort of everything in between. Your, you know, dry skin, dry eyes, hot flushes, night sweats, which can happen even before your periods have stopped. We see joint aches and pains can be common. Lots of theories as to why that is. Estrogen is a very weak anti-inflammatory. That might play a role. We see changes in your dental health. Now that's more with menopause than it would be with perimenopause, when you actually don't produce estrogen anymore. Even IBS, irritable bowel syndrome, palpitations really common as well, and so on.
I've heard of people ending up in the emergency room because of those, and they're saying everything looks normal, and they're like, it doesn't feel normal.
I know, but like worth getting checked out. So we'd always advocate, if you have palpitations, get them checked out. But if everything else has been ruled out, it's often a hormonal issue, because it's hard to measure that in the A&E, you know. And then genitourinary symptoms. So that's your vaginal dryness, changes in how pleasurable or comfortable sex is, peeing frequently, needing to get up at night time where you didn't before, incontinence. The truth is, because it does sound, I totally agree, sounds absolutely terrifying. However, most women get a sprinkling of all of these. They don't get everything.
They're not getting everything.
Yeah, some women do, but they're unusual. And some women, about a fifth of women, have their periods stop. They don't get hot flushes and night sweats. Their symptoms are tolerable and don't have an impact on their quality of life. That's a fifth. Like, it's not a small percentage.
Part of that.
I know that you all do.
Part of the fifth. I think I already know I'm not.
But important to know that, like, you know, if you're sitting listening to this, that like, it's not like I'm telling you every woman is going to get all of these symptoms. These are all the possible symptoms, and whether you get them or you don't is really individual.
Like the menstrual cycle, you're not going to get absolutely everything. You might get, like you said, a sprinkle of some symptoms, and
depends on the person.
For some people it's more severe, for others they can sail through it. So I suppose it's just to be aware of what's happening to your body, and to, you know, yourself better than anybody, and to recognize if you're feeling off.
And to join the dots, I think. Because I agree with you that if you're not getting the hot flushes and night sweats, which are the kind of classic, that's what everybody thinks of when you think of menopause. You know, I'll get women who come in and they'll say, look, I'm not sure this is connected, but every 4 weeks I get X, Y, and Z. I'm like, well, there's a cyclical pattern. Like, this is definitely hormonal and will be, you know, is manageable.
So what's the average age to hit menopause? And if you can just explain menopause versus perimenopause, I think that's really important.
Because perimenopause is kind of a new word for people, and they only might have heard of menopause for years, or going through the change
and all these other that time of your life
and I think we need to talk about, you know, what exactly happens at each time, you know, this. What is perimenopause? What is menopause?
So perimenopause is your ovaries trying to keep the show on the road. They're trying to ovulate once a month. And they're struggling.
There with a clipboard. Come on, you can.
And half the staff haven't turned up.
She's pep talking them. They're not listening. You know, and so early on, like I said, because you have reserve in your ovaries, they respond really well to the stimulation. But often they over-respond, and that creates its own issues. But with time, they respond less and less to your brain's production of this hormone FSH to stimulate them, until eventually they don't respond at all. They've got no estrogen. We're out. Our follicles are done. We've got nothing. Leave me alone. And you stop ovulating. So the word menopause just means your final period. But we don't know it's your final period until you've gone 12 months with no bleeding.
Yes.
So it's a diagnosis that you make looking backwards, you know. So after a year, you can look back and think, oh, that was my menopause a year ago. Everything from that point on, you are post-menopausal. So you were just after your last period. That's all that means.
12 months of no period.
Then you're post-menopausal.
Is the menopause year.
Basically, yeah. And actually, that's where a lot of women are at their most symptomatic. The year before your final period and the year after your final period. That's when hot flushes tend to peak. And the average age is 50-51. And the lead up to that, where things are really turbulent, that's perimenopause. And it's impossible to draw a start line on that. And things can, perimenopause really messes with your head, because you can be symptomatic for a few months and then things even out. Your ovaries sort of find their groove again for a few months. Your symptoms go away. You think, oh, I was going mad, or I've just imagined it. And then it happens again. And then those times of being symptomatic become more and more frequent until eventually you're symptomatic all the time.
Yeah. And the penny drops and you're like,
and then you're like,
aha. Okay, I need to go see Dr. Caoimhe.
There you go. Yeah. And so that's what happens. So it's just this gradual, but it's not a fixed point in time. And even after your final period, you still produce little blips of estrogen.
Yeah.
Really, and younger women, like women under the age of 40 whose periods stop, and we measure their levels and we say, oh, this is premature ovarian insufficiency, which is the kind of technical term for really premature menopause. They can still ovulate and they can still get pregnant. I think it's 2 or 3% per year is the rate of pregnancy after a diagnosis of POI. So,
surprise.
Well, you have to plan around that if it's, but it's not fixed.
Ideal.
You know what I mean? It's not kind of, well, you're done and they'll never go back to normal. You can still see blips happening.
Yeah. Some people's periods get lighter and some people's periods get heavier. Yeah. And tell us about this thing that's called flooding, because sometimes it can happen to some people. I suppose maybe they haven't had a period maybe in a couple of months perhaps, and maybe the lining is it because it's just thicker, building up and it was just sitting there waiting for a long time.
Lovely mental image. Thank you for that. Yeah.
And it's like, ta-da. So what happens? And I suppose, do they need to prepare and make sure they have a pad all the time in their bed?
They need to go chat to their GP is what they need to do if they're having that. Yeah. So we had talked before about kind of, well, how do you classify what is a heavy period? And I was saying, it's 80 mils, but no one actually goes around, thankfully, measuring their blood loss. And it's more to do with the impact it has. Yeah. But they're so flooding and clots are two things that we do use as a kind of reflection that your periods are a bit... that's heavy bleeding if that's happening. Flooding just means no matter what I wear, I go through it.
Yeah, okay.
So I have a pad on, I have a tampon, and I'm still leaking through that. That's what flooding is.
And sometimes it can happen in this perimenopause phase or menopause?
More commonly, yeah. And so about a third to a fifth of women will have really heavy bleeding, problematic bleeding at some point in their life, which is incredibly common if you think about it. But
that's a lot of women.
That is a lot of women, I agree, yeah. But a peak incidence, so most of that is happening at perimenopause. Okay. And it's to do with, we had talked about you have to make a certain amount of estrogen and then you this other hormone, progesterone, to make your nice kind of, put together lining, and then it all comes away in a nice uniform way. Because perimenopause is just a mess. I'm making X amount of estrogen today, but I'll make a different amount tomorrow, and it's just all over the place. And you may not be ovulating, so you may not be producing this other hormone, progesterone. All you do then is just thicken the lining and then thicken it more and then thicken it again. And then eventually get so thick it's not sustainable, and you have this really heavy period. Okay.
Yeah. I think that's an interesting one to explain to people, because sometimes they don't realise.
Not getting your period or it's irregular, that lining is still thickening up. So
be prepared.
So when the next one comes, it could be quite heavy.
Yeah. Now, obviously, for some women, as they get closer to their actual final period, they're not producing a huge amount of estrogen to begin with.
Much of a lining.
Exactly. Which is why the periods get lighter. Yeah. Yes. But in early perimenopause in particular, it's heavier and more frequent periods is what we see.
Okay. Our next question is that we've heard that women have maybe gone to their own GP and had spoken about their symptoms, but they ended up being told you should take a sleeping tablet or an antidepressant, when really what they really wanted was HRT. And how can those symptoms kind of be similar in perimenopause? Do you know what I mean? Perhaps they could get mistaken for something else when really it is a perimenopause symptom.
Yeah, I think it's useful I discuss with every woman who comes in, look, there's 3 different avenues and they're not all exclusive. You can do all 3, or you can choose what suits you best.
Mix and match.
Totally. Yeah. Here's my pick and mix bag.
Yes.
Here's my buffet for you,
Yes.
right? So number 1, you have lifestyle approach. And so things like reducing alcohol and caffeine and exercising more. And we talk through all of that. Yeah. Things like cognitive behavioral therapy can be really helpful for the mood and anxiety symptoms. Your second, behind door number 2, then you have non-hormonal options. Okay. And that would be things like antidepressants. And they do have a role. Yeah. We've sort of swung the other way almost, that like they're the devil and no one should be on them, when actually they can be really effective. They're really safe. Yeah. So they should still be on the table because they're really appropriate for some women. Mm-hmm. And then your third option is hormone therapy, which for younger women is sometimes in the form of the pill. So it doesn't have to be HRT in inverted commas, but and sometimes it's all 3. Okay. I'll do my CBT. I'm going to change some lifestyle things. I'm going to start an antidepressant because my mood is just so pervasively low. Yeah. And maybe I take some HRT as well, or some other version of that mix. It doesn't matter. It depends on the person. Okay. But there's crossover.
Yeah. You know? Yeah. It's like finding the right mix for everybody.
Yeah. Isn't it?
Yeah. When it comes to HRT, tell us about what options there are, because we hear about estrogen and then we hear about progesterone and then like vaginal estrogen as well and testosterone. So what, like, just explain a little bit, I suppose, more about
if you think of what you're trying to do with HRT, so a woman who is menopausal, my periods have stopped, I'm not producing any of my own estrogen anymore, that's where the R in HRT is. It's hormone replacement. We're literally trying to give her back some estrogen that she's not making herself anymore. Perimenopause is a lot more kind of complicated and challenging. And essentially what you're trying to do is calm that hormonal environment down. So you're trying to make the roller coaster go back to kind of like a more smooth...
A kid's roller coaster?
Exactly, yeah. Like teacups. You're aiming for teacups, right? So that level of sort of turbulence and bump, Yes. And we do that by giving your brain this constant supply of like the safety net of estrogen. Yes. So your brain interprets that as like, oh, we're not running out of estrogen at all. All is well. Everything's good. You know, that little 4 woman in your brain goes off to have a cup of tea and stops screaming at your ovaries. So they stop overproducing estrogen. Okay. At times they stop having dips because you've given them this kind of safety net. And the hope is the hormonal environment becomes a bit more stable. And you're also safety netting women from the beginning of bone density loss, which starts when we start losing estrogen, and the other changes that we'll probably talk about in more depth at another time and not today. But so that's why they're used for different reasons at different points in your life.
Not everyone needs everything. It's like that. What you said, it's a pick and
mix. It's a mix and match.
That you might need a bit of that with proper nutrition, perhaps even some supplements as well. Like it might be a good idea for someone to go for basically an MOT or /NCT like of your body really at the doctor and just see where you are at that point of time, you know, and just get an overall health check to see where you are. And do you provide that as well in your clinic?
Well, we do, because we talk to women about cardiovascular risks. So we check their cholesterol, we do their blood pressure, we look at other risk factors, we talk to them about smoking cessation, all that kind of thing. And then screening becomes really important. So cervical smear screening from your mid-20s, from the age of 25 onwards. And so you want to keep that up. A lot of women, I think, mistakenly think, when my periods have stopped, that's brilliant now, no more smears for me, but actually you need to keep going. So we'd recommend cervical screening then from your mid-20s till you're at the age of 65. And then mammogram screening starts at 50 for most women, every 2 years till you are 69.
Every 2 years?
Every 2 years.
Wow,
Yeah.
You get your boob
squished.
Nice.
You've never had a mammogram?
I actually had to, because last year I had squeezed a tiny spot that was on my boob here, and it obviously kind of went under the skin, and it felt like a tiny little lump. So obviously I had to go and get it checked, and I did, and they said, no, that's nothing sinister. You
stop squeezing your boob.
Stop squeezing your boob. And I was like,
I actually did a TikTok about that, and it went viral.
It did.
And so stop squeezing your boob.
Stop squeezing your boob. So I squeezed a little spot, and the skin had gotten a little bit hard underneath. But yes, I had to go into the Galway clinic, and they checked it and everything. But I did get a mammogram, and it was like, whoa. Squeezy.
It is squeezy. I had one recently, and same idea, and thankfully turned out to be nothing. But yeah, they were squeezy.
You're
squeezy,
like,
aren't they?
well, very squeezy.
But I find it fascinating of this buffet and options that you give to women, and I think that sounds absolutely amazing. And obviously, that's the differentiation between your clinic and what has been available in the past. Because I'm guessing you came here and went, oh my God, so basic, and they're not getting the time and the options.
Yeah.
I think it's time is probably the issue. Yeah, because I think in general,
listen to what their stories are, because they're all so different.
But again, in a general practice setting, for most GPs, how do you do that when you only have whatever amount of time?
What's the time allocated in a general?
Depends on the GP surgery, but 10 to 15 minutes. And then you're like under pressure to do that in
roll out your list really quick.
Just tick everything that applies to you.
That's actually a good idea. Anyone that does go to you, do you like for them to have a little list? Because sometimes when you're in a setting like that you're trying to say everything, they might actually forget something. It's a good idea, to...
Yeah, we all differ, actually. Dr. Nicaran Aoife, who works with me, she uses a symptom checker. So she will ask patients to come in, and they have, and I think it really organises their thoughts, and it probably focuses the consultation nicely. I'm a bit more loosey-goosey with it, and so like so it just depends on your own preference, but I find I prefer the kind of conversational, like it just kind of comes up as we're chatting, and I'll ask them then if I think they might have left something out, or they haven't mentioned, say, vaginal dryness or something, I'll ask them, so it just depends what way you like to practice, and it depends on the patients. Some patients like to come in with their folder, they have their stuff prepared and they have their symptoms written down, and others are again a bit more kind of, I'm not really sure why I'm here, and then as they're chatting it all kind of comes out,
I suppose it evolves from your first
depends on the person,
chat with them and what they need for themselves. And I love the way that it's so personalized and individualized for her and what she's going through.
This podcast is brought to you by our very own brand, Key for Her. Whether you're feeling the effects of menopause or your menstrual cycle, discover what's key for you in less than 5 minutes with tailored supplement recommendations, information and insights on keyforher.com.
Please have 20% off on us by using the promo code KEYPODCAST in all capitals. So what way does that work then? Does she come into you regularly if you find that she is more than likely in perimenopause? Where does it begin?
Okay, so that obviously depends on the person, but usually what we'll do is we'll meet someone for an initial consultation, which is 40 or 45 minutes, and then we will bring them back if they're starting a new medication. Typically, if it's hormone therapy, we'll bring them back after 3 to 4 months. Okay. And then if they're doing well at that point, which most people are, thankfully, we'll see them every 6 months after that.
Brilliant. So like the time alone that they're getting is far more. So it sounds like if you are experiencing symptoms, going to your clinic and getting the time to actually speak and talk about how you're feeling.
Sit in my dentist's chair.
Yeah.
Yes. Yeah.
Hopefully get it the right way around.
My bladder was my first perimenopause symptom, and I woke up one morning and it was like unbelievably sore, but I'd been out to a restaurant the night before and I had a glass of a fizzy drink, and it took me a long time to actually realise fizzy drinks, alcohol and coffee were really irritating my bladder. But a lot of the time if I had it on the day, I wouldn't feel it until I woke up the next morning. Okay. My bladder would be really full feeling and irritated. Yeah. And I actually had been to the doctor saying, what's wrong here? And all these tests were coming back negative. But I remember at the time they said, how are your periods? I was there, grand. And then that was it. I really wish they had pushed me more on symptoms and, pushed more on like this could be perimenopause, because I could have saved myself an awful lot of hassle like 4 or 5 years ago. I think it's just to ask the questions, really.
Join the dots.
Join the dots. Yeah. And it's only by looking backwards that you're able to understand what's happening,
what's going on.
Yeah.
When it comes to like hot flashes and sleep disturbances, that's quite often a symptom, quite common. Would they be the kind of in the top 3? What are the top 3?
Yeah, what are the main things that you see coming in?
Yeah, I think hot flashes and night sweats are probably number 1.
Okay.
And because that's about 70 or 80% of women will get them at some point. And
then is it like mood, do you think? Or...
I'd say mood probably is in the top 3, and I'd say sleep is probably in the top 3. Those and joint aches and pains are
good. then it affects everything
they're
else.
connected, because if you're waking up with night sweats, obviously you're going to have sleep disturbance, and then you're going to feel like crap, and so your mood is
and
affected.
your energy will be low then as well. And then if their energy is low, then they might be reaching for these high sugar treats to try give them a bit of a pick me up, and you're on this kind of roller coaster
and caffeine, and then you start peeing more, and then like it's just a vicious circle. One of the kind of fundamentals about treating women at this point in their life is to look at sleep.
Yes.
And some people, no bother at all. Vast majority, I definitely noticed a change in their sleep pattern. And it's either because they've genuinely lost their normal sleep pattern, so your melatonin production changes and their ability to stay asleep changes, so they're waking at 3 or 4 in the morning and they can't get back to sleep, or they're being woken by needing to pee, or night sweats, or restless legs,
very loud snoring noises, because don't you become
I have
more
no pill for that, I'm afraid.
more
annoying partners.
You're more awareness of like noises apparently, and is that right?
Your perception we've heard of taste and sound can change in perimenopause, and it's more heightened.
Didn't know that, but it makes a lot of sense.
Did a funny TikTok where I was just like listening to this crunching sound, you know, and it went viral because so many people could. And I'm sitting there pretending to eat, and you know, he's making this crunching sound as though, and I'm like, ugh. And so many people had said they can't stand certain sounds now.
I already have that. Like,
it's like this
rude.
Same.
It can be quite annoying. These symptoms can be kind of crazy.
So we talked all about symptoms and all about how the menopause starts and what it's all about. And I suppose going forward now, you're going to give us all this amazing information about, you know, specific things as we go through perimenopause and menopause. Like the different options, more in depth about HRT and other things like that. But I suppose it seems very negative, and it's something that we want to communicate that it's not all bad for everybody, and you don't get everything, and we should look at this as a positive new phase in life. And how does a woman approach that in a more positive way? I suppose instead of looking at it negatively.
Yeah, I think knowing that there are options, so it doesn't have to be something that you're scared of, because we can treat it. And regardless of whether it is the mental health issues or it's physical issues or it's vaginal issues, we have treatments for all of that. It's just a conversation to be had. So there's no reason to be scared of it.
And there's a whole clinic now.
There's many of them. There's more than just me. We've loads of GPs who are more interested now in being kind of trained up. And so it is great. So there's loads of help out there. Women are talking about it more. I think that's brilliant. I think that's empowering for women as they go through this. I think feeling like there's kind of almost like a group think, they're all in it together. You know, I think that's really important. And like any phase of your life, it comes with pros and cons. And benefits and other and downsides, like any change in life. But definitely not something to be scared of, and not something to kind of put your head down and avoid. I think chat about it, talk about it, reach out.
And the sooner you do something about it,
definitely,
like whether it be lifestyle changes or, you know, visiting you or anything else that can fit in, like, and more self-care. I think people need to like look after themselves a bit more and put themselves first. They've spent their whole lives looking after everybody else, and they might have aging parents as well now, and there's a lot of stresses in their life. So the more things they can do now just to make it all a little bit easier, the better.
Totally agree. Yeah.
So what are your 3 key tips for perimenopause and menopause?
Okay, number 1, and reminiscent of the last time we talked about this, but I think embracing the information that's there, educating yourself, and knowing what to expect, knowing what are red flags and things that you should be maybe reaching out for help for, and preparing yourself with that knowledge is really important. I think discussion is so essential. I think just normalizing it and knowing, okay, God, that's really interesting. Some women have loads of symptoms, you know, my neighbor had no symptoms and I have tons of symptoms, and kind of getting a feel for, the more we talk about it, the more we see this beautiful array of individuality that happens with menopause.
It's all happening around us.
And I think that takes away a lot of the fear potentially. And there's a sense of community with that, which I think is really important. And look for the positives.
Yes.
Maybe your kids are a bit more grown up and so you have a bit more free time. Maybe you've reached a part of your career where you're a bit more independent, or you're, you know, you know, it's more challenging or more rewarding in your career, and embrace that, and know that the symptoms holding you back are not something that you have to put up with. So look for the positives.
Fantastic.
Yeah. So thanks a million for coming in to talk to us today, and we are so delighted to have you in as our resident health expert. If anyone wants to find Caoimhe or chat to her, you can go onto our website, which is menopausehealth.ie. You can find her on social media as well, and we're looking forward to all the juicy chats that we're going to have again in the future.
Thanks very much.
Thanks. You.
Thank you so much for joining us on the Key for Her podcast. We'd be so grateful if you could hit subscribe, rate, and share this podcast with your friends.
For tips, tricks, and hacks on all things perimenopause, menopause, periods, menstrual cycles, and skin health, follow us at Key for Her on TikTok and Instagram.
Check out our website, keyforher.com, for more information.